coincidentally, I was on air at the very hour that the story came through on this day, on the 5th of March 2020, Professor Tulio de Oliveira. So it's come full circle over a period of 2 years. But let me start here. I see on your Twitter, you tweeted about a few hours ago, low tide and a beautiful sunny day to recharge energies. I would say you need that given the 2 years we've heard. Just your reflections of what has depleted your energies such that you need this kind of recharging that you are undergoing at the moment.
Yeah, thank you, and good afternoon. I don't think that's just for me. I thought that as a country we had 2 very difficult years, and of course it is fantastic to see the country going back to normal, and the economy be going back to normal, students go back to the university, and I think that we all need to go back to normal, but we also need, as you say, to recharge our energies, because we still have to keep our guard up, at least on the scientific front. We have to make sure that in case a new variant comes, that we detect that very early and very quick, and that we can guide our government with very good information to try to avoid another deadly wave.
Prof, my introduction talks about lessons we've learned over the last 2 years. And I imagine that there can be hundreds of lessons that we have learned. But specifically in the scientific community and in the kind of work that you do, what are the key lessons that we have learned over these last 2 years?
Okay, on the scientific community, that was a very positive story for South Africa. One thing that we learned that we can work together, and if we work together, the scientific community in South Africa, we can lead the world. And that's highly recognized. So this week, the work that was done in South Africa, especially on the genomic surveillance, was recognized as one of the 10 most important breakthrough in technology by MIT, that's the Massachusetts Institute of Technology, and really recognized it well. We also learned that if scientists can work very close with public health officials, we can act very quick to new waves, and that was best exemplified on the Omicron. Despite a high number of infections, we managed to keep mortality very low. And we also learned that if scientists also communicate well with the public, we also get the public trust, and by getting the public trust, especially in this age of misinformation, it's really important to respond quick to epidemics, but also what's happening in South Africa now to go back to normal.
Prof, the issue around South Africa being able to detect new variants it came to the spotlight upon the country sequencing and identifying the Omicron variant. But our capacity to sequence was not new, was it? And would you say that stood us in good stead when this became initially an epidemic and eventually when it was considered a pandemic?
Yes, exactly. You are absolutely right. One of the reasons why South Africa could do very well on the not only genomic surveillance, but in the clinical response, on the immunology, on the evaluation of vaccines, is the very strong capacity and systems that have been put in the last 20 years to deal with the HIV and TB epidemics. So it was nothing new. We already have the technology. We already have a lot of the lab and the expertise. But what was new is how quick we could pivot, to respond to a new virus. So as you are highlighting that 2 years ago on the 5th of March, the country had the first case. By the 5th of March of 2020, we already have set up like all the diagnostics in South Africa. We have a coded software to do analysis of genomic data. We already had all the reagents. We already really ready to respond. To be honest, we even managed to sequence a contact of the first case that happened in Hilton, in KwaZulu-Natal. And that was really important, what you call pandemic preparedness, And that's something that I believe that we have to invest more in South Africa and the world there to make sure that all the resources exist in case a new epidemic emerge. Some of your viewers may have listened last week. That's a potential for a Rift Valley fever. That's a hemorrhagic virus that normally infects cattle, goats, and sheep to emerge in the middle of the country. And what we did together with the National Institute of Communicable Disease, but other scientists, is just to be prepared in case that emerge to respond very quick.
Two quick questions, Prof. What's your assessment of where we are in as far as the pandemic response is concerned and the ongoing need or otherwise of many of these restrictions that we continue to live with? I'm sure you will have heard the debate about the state of disaster, even the president stating his intention that it needs to go. Today, the Soweto Derby is playing. In over 2 years, it's not had any fans inside the stadium, for instance, at FNB Stadium. Is there still a need for that level of precaution?
I think normally it is better to err in the side of precaution than the opposite. For example, see what's happened in the United States of America and the United Kingdom, countries 10 times better resource than us, and they end up with a much worse pandemic. In relationship to football, I'm very biased. I do like football a lot. And I will be one of the first person, and I will take my son as soon as we can go to the stadiums. I personally think that's safe to open the stadiums, and we saw that not only with football in Europe, and that's something that we all need in South Africa. We just need to go back to normal and have the little pleasures in life, which sometimes watching a nice football match can be.
And lastly, Prof, the other quick question I wanted to ask, as you scan your radar systems, and I know that you can't make a prediction, but perhaps a projection at least, and have expectations based on the work that you are doing. How are we looking in terms of further variants coming through? But accepting that maybe your answer to that may be affirmative, that we are likely to see further variants, the strength of those variants and potency thereof. Can we read anything from Omicron about the likely strength and potency of subsequent variants that are likely to come?
Okay, so one of the main reason, if it's not the main reason why Omicron was not so deadly, was not really by the variant itself. It was by previous immunity and by vaccination, And then in the case of South Africa, when Omicron hit, we had very empty hospitals. We are at very low number of infections, so we have the clinical and the healthcare capacity to respond, And that's again that what we should be doing as scientists, as public health clinicians, and at the country be prepared in case another variant emerge. It's likely that another variant will emerge, but also it's going to be likely that all the preparation, all the vaccination, all the previous immunity, and the knowledge from the clinical staff, it will help to translate into less death. And again, it's never late. To go for a extra vaccination or a booster for people that we're at advanced age or comorbidities, especially because it would be fantastic if we could be even prepared for the winter, when is the most likely time that a new wave may start. And what we want, it is what happened with Omicron, but with less panic, especially from other countries. That we may have infections, but we don't translate in very sad deaths of our population.
Professor Tulio de Oliveira, let me leave you to enjoy your rest and relaxation. I won't pry and ask where you are, but it's spectacular, the views at least that you have shared. That's a crisp director there, Professor Tulio de Oliveira, who is also a big football fan, as you heard.